Eating too little while taking Wegovy, Semaglutide, or Zepbound, Tirzepatide, can turn weight loss into nutrient deficiency. 5 warning signs deserve attention: persistent fatigue, increased hair shedding, declining strength, numbness or tingling, and lasting changes inside the mouth. These medicines do not usually block nutrient absorption. The problem begins when nausea or strong appetite suppression sharply reduces calorie intake and food variety. Regularly skipping meals can lower body weight while leaving the body short of nutrients needed to maintain blood, nerves, and muscles. A smaller appetite is an expected effect, but being unable to maintain even basic food intake for days or weeks is not a treatment goal. You should still be able to drink fluids, eat several small meals, include protein, and maintain enough strength for daily activities. The first warning sign is fatigue that does not improve after several days and continues to worsen for weeks. A temporary drop in energy after a dose increase may come from eating fewer calories, dehydration, poor sleep, or nausea. However, fatigue that interferes with daily activities or occurs with rapid weight loss and a restricted diet deserves attention. Eating too little can also reduce your intake of iron, vitamin B12, or folate. These nutrients are needed to produce healthy red blood cells, and a shortage can lead to anemia. Anemia reduces oxygen delivery to muscles and organs, which can leave you feeling unusually tired and weak. The symptoms may go beyond feeling tired. Dizziness, shortness of breath, headaches, pale skin, or a racing heart during ordinary activity may suggest anemia or another nutritional problem that needs testing. The second warning sign is noticeably heavier hair shedding. Weight loss itself can push more hairs into a resting phase, so shedding does not prove a vitamin deficiency. Concern rises when hair loss follows weeks of eating too little, especially too little protein. Signs of low iron or zinc make a nutritional cause more likely. This type of shedding often appears months after someone starts eating too little. That delay can hide the cause. The trigger may have been earlier rapid weight loss, repeated nausea, or poor protein intake, long before the hair changes become obvious. The third warning sign is declining strength. Struggling to rise from a chair, carry groceries, climb stairs, or finish a usual walk can signal muscle loss. Protein provides building material, while strength exercise tells the body to preserve muscle. Muscle loss is not diagnosed by soreness after exercise. Fewer repetitions, slower walking, weaker grip, and needing furniture for support are more useful clues. Older adults and people who began treatment with low muscle mass need closer monitoring. The scale can keep falling even as the weight loss becomes less healthy. A lower number does not reveal how much came from fat, muscle, or water. Treating every fast drop as good news can encourage an eating pattern that leaves a person weaker. That eating pattern can also slow recovery from illness or injury. The fourth warning sign is new tingling, numbness, burning feet, poor balance, or unusual confusion. Vitamin B12 supports nerve function. Thiamine, also called vitamin B1, helps nerves and the brain use energy. A severe shortage of either vitamin can injure the nervous system. Repeated vomiting raises the risk of thiamine deficiency because intake can collapse quickly. Confusion, trouble walking, abnormal eye movements, or rapidly worsening weakness should not wait for a routine appointment. Those symptoms need prompt medical assessment, especially after days of vomiting or almost no food. The fifth warning sign is a sore, smooth tongue, cracks at the corners of the mouth, or repeated mouth ulcers. Iron and several B vitamins help maintain mouth tissues. These changes become more meaningful when they accompany fatigue, pale skin, numbness, or a restricted diet. Not every mouth sore is nutritional. Dental irritation, infections, and immune conditions can look similar. The useful clue is persistence. A lesion caused by biting usually heals, while repeated or widespread changes alongside poor intake deserve evaluation. One symptom from an internet checklist proves little. Concern rises with a cluster: reduced intake, rapid weight loss, limited food variety, and declining function. A symptom pattern can guide which tests are useful, but diet history and targeted blood tests are needed for confirmation. Start with the eating pattern. Count how many meals you can finish, how often protein appears, and whether entire food groups have disappeared. Also note vomiting, diarrhea, constipation, fluid intake, and the timing of each dose increase. This history often points to the cause more clearly than guessing which supplement to take. Testing should match the symptom pattern. A complete blood count checks for anemia. A ferritin test estimates the body's iron stores. Vitamin B12 testing is useful for numbness or balance problems. Blood tests can also show signs of dehydration, which can cause similar symptoms. Tests for vitamin D or specific minerals may help when symptoms, diet, medications, or medical history suggest a specific deficiency. Choosing tests that can change what your doctor does next is more useful than ordering every available test. Do not answer every symptom with a handful of supplements. Iron can worsen constipation and becomes harmful in excess. High doses of some vitamins can also cause nerve or liver problems. A standard multivitamin may cover small gaps, but it cannot replace missing calories, protein, or medical evaluation. Persistent nausea, vomiting, or extreme fullness can make even small meals impossible. The practical threshold is simple. Treatment is too aggressive when you cannot meet basic nutritional needs despite reasonable meal adjustments. Your doctor may delay the next dose increase, lower the dose, or treat the stomach symptoms. Build meals around foods that deliver more nutrition in less volume. Start with eggs, yogurt, fish, chicken, tofu, beans, or another tolerated protein. Add fruit or vegetables, then a starch or healthy fat as space allows. Liquids between meals may be easier than drinking a large amount with food. When solid food feels difficult, softer options can help. Greek yogurt, cottage cheese, soups with beans or meat, and a simple protein shake may be easier to finish. Choose a drink that provides protein, not one that is mostly sugar with added vitamins. Then track function along with body weight. Record how many times you can stand from a chair, your walking time, or another repeatable measure once weekly. A stable scale with preserved strength can be healthier than faster loss with worsening weakness, falls, or exhaustion. Rapid weight loss also deserves context. A large early drop may include water, especially when carbohydrate and salt intake fall. Continued fast loss with skipped meals and declining strength is more concerning than an early water weight drop. That combination should prompt a nutrition review, not celebration. Seek urgent help for fainting, confusion, inability to keep fluids down, very little urine, chest pain, or trouble walking. These findings may reflect dehydration, dangerous salt and mineral imbalances, bleeding, or severe deficiency. They are not symptoms to solve by waiting for the next scheduled injection. The 5 warning signs are persistent fatigue, heavy hair shedding, declining strength, new nerve symptoms, and lasting mouth changes. None proves deficiency alone. Together with low intake or repeated vomiting, they show that weight loss may be costing more than body fat. The goal is not to force normal-sized meals while taking Wegovy or Zepbound. The goal is to make smaller meals nutritionally complete enough to protect blood, nerves, muscle, and daily function. Weight loss remains successful only when the person becoming lighter is not also becoming weaker. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.